In this video, I'm going to walk you through how to begin a dissection of your fetal pigs here in A&P2. To begin with, you want to make sure you pick a male or a female pig. You can sex the pigs by looking just below the tail at the anus. If the pig has what's known as a urogenital papilla, that little projection that you see right there, that's a female pig. If the pig does not, then that is going to be a male pig. You'll just see the tail and then the anus. And what you might also see, of course, this pig's been dissected, but you can see the scrotum right here. Will bulge just a little bit. So make sure you know the difference between your male and your female pig. You also want to make sure that you get two pieces of twine, and you're going to use those pieces of twine to tie the pig's hind legs and their forelegs like this, so that it keeps the limbs separated. It makes dissection a lot easier because the pig stays still. Make sure you're wearing gloves, right? Everybody has to be wearing them to dissect. And then make sure you have one of each of these instruments: a pair of dissection scissors, blunt end tweezers, a blunt end probe, and a scalpel. The scalpels will likely become dull while you're dissecting, so reach out to an instructor or a TA to help you change the blade. So when you begin to dissect your pigs, you want to make sure that you start out by essentially drawing or carving a midline that you can follow. And that midline, as you can see right here, needs to go all the way up to the chin. Now, I use a scalpel to do this, and so I'll just kind of make a very light incision all the way down from the chin to the umbilical cord. And you can see the umbilical cord right here. And it's not one that actually goes all the way through the layers. That's how thin the incision is going to be. It's just going to be enough to basically mark the skin, so you've got a line you can follow. After that, you can begin applying a little bit more pressure with your scalpel to make further and further incisions. Now, all the while, I want you to be cognizant of the fact that just below the surface, you're going to see some pretty soft organs, right? Here, muscles that you could puncture. And then here in the abdominal cavity, the same thing. The liver is going to sit just below the skin. So you really want to make sure that you're not cutting too deep with the scalpel itself. Okay. So with the male and the female pig, this incision here in the chest and the neck is going to be identical, right? And so obviously in this situation, the chest cavity is going to be closed. Okay. As you make your incision, you're going to see that there's some fat. Here, this female pig has quite a bit. Right, so you may have to cut through the skin plus the fat, and then, like I said, you're going to come to a layer of muscles. So in the neck, there's basically three groups of muscles that are long and stringy. I've got this set right up here. Okay, so I'll lay it down, show you what it's going to look like as you open it. And they're going to run basically from the throat down to the sternum, just like that. And so as you open up the pig at first, you're not going to see the trachea, nor will you very easily see the thymus or the thyroid gland. So what I recommend that you do is actually take these muscles and actually cut them here from where they connect to the sternum. And then you can typically just reflect those back like that. Okay. And what you can see right underneath here is actually going to be the nice cartilage, right, that surrounds at the very top of the trachea. Okay. And right alongside that, you can actually begin to see regions of the thymus. Right? And that thymus is actually going to extend all the way down to the surface of the heart, and I'll show you how to reveal that in a second. And then, of course, what you can see right here is another layer of muscles, and those muscles tend to pull pretty taut, just like that. And so you just gently tease those apart. Right? And there you're going to see that singular thyroid gland right there. And so that's going to look exactly the same in the female and the male pig, so no difference there. And the next challenge you're going to run into as you dissect is actually opening the chest cavity. So I have cut through the sternum here. The best tools to do this with are going to be the scissors. So you can see scissors right here. They tend to have the pairs of scissors that have the very sharp tips like this, and then some of them look like these scissors where you have one tip that's sharp and one tip that's a little more blunt. As you cut into the chest cavity, make sure that you're not cutting downwards, because as you make it through that bone, you could accidentally puncture the heart. And so I tend to tell students, I'll turn the camera to an angle here, as you cut, make sure you're applying pressure up. So you would push up with the scissors and then cut, right? Go underneath, push up, and then cut, right? And so that's going to help you just make sure that you're driving the scissors upwards and not downwards into the heart. The most difficult aspect of this part of the dissection is where you reach the very top of the sternum here with the manubrium. This is where it's going to be the thickest, right? And so it does actually take a little bit more time to cut. And in addition to that, right below that part, you're going to actually see a nice collection of blood vessels. Now, these have been drained with blood, and they've been injected with blue or red latex. That way you can see them really clearly. You do need to keep these blood vessels intact. So as you begin to break through this top part of the sternum, do so with a lot of care and caution. Make sure that you're just removing bone little bits at a time. But you will need to make sure that you cut that apart so that you can see the heart right here. Now, looking at the heart, you can see there's this really nice sac that surrounds it. So we're going to talk about the layers that form this. As a single name, you can refer to it as the pericardium. So the heart is trapped in that pericardium. You can also see the lungs right here off to the side. Okay, so the right lung, and then over on this side you can see that dark brown left lung. And then right here on top of the heart, kind of attached to that pericardium, you see this gland, and that's going to be part of your thymus. So the thymus here, because these pigs are fetal, is pretty large. You see it beginning there on top of the heart and then running all the way up the neck, just like that. And now the next part of the dissection is going to be different depending on whether you have a male or a female pig. All right, so two things you want to reference right here, and that's going to be the basic location of the diaphragm. So here, obviously, it's easy to see because I've already cut open the pig, but this big muscular roof right here over the liver, there it is on that side, and here it is over here on this side, right? All that is the diaphragm. Now, before you open the pig, that's kind of hard to see. And so what I tell students to do is to palpate. So basically feel down the surface of the chest, and you'll be able to feel the ribs right there. And then once you come to a point where the ribs end, that's a pretty good estimate of where that diaphragm is also going to end and where the beginning of the abdominal cavity would sit. And so here I recommend scissors, right? So take your scissors and begin here at the medial portion and cut all the way down on the side. And you can see I've cut pretty far here. Right, you want to open that up quite a bit, give you a lot of ability to kind of move around and see inside the abdominal cavity. Same thing over on this side. Right? Now, one of the things you want to look out for here is this vessel. Now, this is going to run from underneath the liver all the way here to the umbilical cord, as you can see. And this is called the umbilical vein. Please take care not to cut that and not to tear it. Sometimes it's tempting to want to pull on the umbilical cord to make sure you have better visibility, but that'll pop that vein. So be very careful with it. Leave the umbilical cord right there. Okay. So that's going to be the same incision that you'd see between male and female, cutting along that transverse plane side to side. I'll come over here to the male pig so you can see the same thing. Right, so here we had cut all the way down through the neck, and then of course the trachea, and then here on either side, a transverse line across that diaphragm. As we pick up on our dissection, we're looking at the cuts you'll need to make in the abdominal and the pelvic cavities surrounding the umbilical cord. So to begin with over here, we'll look at the male. Right? So the male incision is going to be made in a way to protect male reproductive organs. So here you can see the umbilical cord, and here you can see this penile orifice right here. It's a little hole, and all along that would be the penis of this fetal pig, this male fetal pig. Now we are going to be maintaining the reproductive organs of these animals because we'll study those this week as well as at the end of the semester. And so it's important that you don't make a transected cut here across that part of the body. And so you're essentially just going to make like a rainbow cut beginning at the top here of the umbilical cord, cutting around and down in a straight line here. Same thing over on the pig's left side, cutting around and straight down. And what that's going to do for you then is enable you to actually pull the skin and the muscles of the abdominal cavity side to side, right? And that leaves here the umbilical cord attached to your umbilical vein, right? And it maintains the penis there inside of the skin, right? So it's not cut. If you look closely here to the side, what you can see underneath is going to be the urinary bladder. It's the urinary bladder, and then on either side of that we're going to start learning about the different arteries and veins that are associated with embryonic development. These would be umbilical arteries, here one on the left and then there'd be one on the right. All right, so let's take a look at the female pig then to see how that cut is going to be a little bit different. Here you can see umbilical cord, right, just like that. And so here it's a little bit simpler. You don't have to cut down and leave this midsection. You literally can cut all the way around the umbilical cord. Okay, so with the female, because you can do that, you end up with much greater visibility. And that's important because the majority of the reproductive structures we want to see here are going to be down in this space of the pelvic cavity. So you need that visibility. You need to be able to see pretty far down in there. Now, take caution here because just like with the male pig, you can see here's the urinary bladder, and there would be these 2 umbilical arteries on either side. So to keep from cutting that when you're cutting around the umbilical cord, typically what I do, and I'll show you here with the male, since this is still intact, I tend to insert a blunt end probe right here in this space. Right, so between the skin of the body and the urinary bladder, and then I insert my scissors in that space with the probe and cut right through the skin right there. Again, only in the female fetal pig, and that way I keep from cutting the urinary bladder that's underneath. So you've got that nice and intact for later study. Okay. So here with the female, you can see this pretty clearly. As you pull those organs over to the side, you're going to see the kidneys right over here, and right underneath that space you can actually see the adrenal glands. So I'm going to try to get in there and show this to you guys. The adrenal gland is going to be a little moon-shaped gland. Whoops, you can't see anything, can you? Little moon-shaped gland right underneath here. Actually, let's see, I've actually found this on the male pig. Let me scoot over this way and show you the male pig. So same thing right here, we're going to move these organs off to the side. And right here, you can actually see the little adrenal gland. Right there. That's him, little adrenal gland, and that's going to sit right up next to the kidney here in both the male and the female pig. Sometimes it's going to be covered up by this thin membrane, right, called the peritoneum. So every once in a while you may have to gently tear that, but be careful, that adrenal gland tears pretty easily, so be gentle with them. Right? You're also going to see underneath this space, again, be really careful that you're not breaking the umbilical vein right over here. You can see it just like that. Make sure you don't pull on things too much and break that. But if you lift up the liver right here and you move the stomach to the side, you can see the pancreas right underneath here. And the pancreas tends to have a green or a yellow color right here. And to me, it has always looked like chewed up gum that somebody then just stuck right in this cavity. This is all the large intestine below it. Okay, so you can see the difference in the organ texture. Okay? That's all going to be the pancreas right there. All right, so that's the majority of the endocrine organs you need to see for both male and female. Now let's take a look at the reproductive organs. To find those that are associated with the male, you are actually going to have to cut down into the scrotum. And so I tend to recommend that students go ahead and continue a very thin incision with your scalpel and cut through the skin. Okay? And as you do that, here on this side, you can see what's going to be characteristic. You're going to be able to see the testes, but they're going to be wrapped in this thin sac right over here. Okay. And so that's going to be attached, that's going to hold the testes in place, allowing them to stay connected to the many ducts that basically allow sperm to travel up through the testes and into the pelvic cavity. You want to dissect one of these testes out, and so that's what I've done on this one. You just very gently cut that tunic that's all around it and just pull it out. And so that's the testis right there. That's going to be the male reproductive gonad, reproductive organ, also responsible for producing testosterone, which is one reason we're looking at it in the endocrine lab. Right, so that's your male fetal pig. As we move over to the female fetal pig, right over here, I'm going to show you where the ovaries are going to sit. So like I said, you want to be able to see here, low in the pelvic cavity. The ovaries themselves are incredibly tiny. So right over here, okay, so we look down in there, you can actually see this tiny little bulb right there, and that is the ovary itself. Okay, so there's going to be a pair of ovaries. This is the left one. The right one would be on the other side. Typically you have to move the urinary bladder aside to see it, and you're going to see it's going to be attached to a series of tubes.